Good evening, everyone. I'm Sarah Peterson Davis, and I'm the Special Events Coordinator here at Mid-Continent Public Library. And I'm here, I want to welcome you to tonight's program, which is a cooperative effort between Mid-Continent Public Library and University Health, and is made possible by a Communities for Immunity grant through the Centers for Disease Control and Prevention and the Institute for Museum and Library Services. And I also want to welcome our three panelists who were very gracious with their time tonight. I know that they're all very busy people, and they've been very busy during this whole pandemic and not only vaccinating, but treating COVID patients. And tonight that is Dr. Stephanie Ellison. Dr. Stephanie Ellison is a emergency medicine practice emergency medicine at University Health, and is also a professor of emergency medicine at UMKC. We have Dr. Jonathan Kendall. Dr. Kendall is a pediatrician with University Health, and we have Raquel Garcia, who is a community health education nurse with University Health. And Raquel, you're on the ground every day, getting those vaccinations in arms, right?
Oh yeah.
Yes.
And weekends.
Well, and weekend and nights, weekends, and days. Let's just get started. We've got a lot to cover, and this is all very important information. And I'm just going to throw it out there. You know, we've been at this for almost 2 years now. We have a lot of vaccine choices. Why get vaccinated?
I could take this one.
Okay.
There's a few reasons to get vaccinated. The first being that we have 3 highly effective vaccines available to us in this country, and they're free. And it is currently our only way to prevent serious illness, hospitalization, and death from COVID. And getting infected has not proven to provide immunity. So the vaccine is necessary in order to help you be safe and to keep your family and loved ones safe from this very infectious and dangerous virus.
And, you know, we just talked about that we have vaccine choices at this point. We have 3, which is more effective. And of course, I think, and you know, is the mix and match a good idea if you're going for the booster? You know, is there one that's more effective than the other? What do you have to say to that? Any one of you can answer that for me.
Raquel, you want to take that?
So there have been studies to show that Moderna has a little more effectability than the other 2, but either one of them is going to be effective of just keeping you from the severe symptoms and from death. So if you get your hands on any one of them, we would be happy that you got any of them. But yes, Moderna has been shown to be a little more effective, only by a couple of percentages, not by much at all. And then Pfizer comes in second, and then Johnson & Johnson. So the difference is so minor that we would just be happy if you were to get any of the 3. But so far, the mixing is pretty much an individual basis. We do have people that if they got Pfizer, they want to try and get Moderna because they want to have the effectiveness of both of them. And then we have the other groups of people who want to stick with the same one. If they got Pfizer to begin with, they want their booster to be Pfizer. And then we also have those that got Johnson & Johnson and believe all of the hype that came out during that time about Johnson & Johnson and want just anything other than Johnson & Johnson. So it is approved to mix any of them. So if you had Johnson & Johnson, you can get any of them. And so you can mix whichever you want, but it is an individual preference. The difference is going to be the timing. So with Johnson & Johnson, you do have to wait less time. So you have 1 shot with Johnson & Johnson, and you only have to wait 2 months when you're eligible for the booster, versus Moderna and Pfizer, you do have to wait the 6 months from your second dose in order to qualify, and when it's your turn to get your booster.
Is the effectiveness of the vaccine, does that translate to the pediatric doses as well? Dr. Kendall, can you answer that?
Yes. So So in terms of the pediatric vaccine, we only have one vaccine that's currently approved for the ages between 5 and 11. Between, after age 11, 12 and up, they can have Moderna or Pfizer. But between 5 and 11, so far we've only studied the Pfizer vaccine, and it's a vaccine that is at a lower dose compared to the adult Pfizer. It's a shot that's still given as an initial dose and then as a booster in 3 weeks. It's 1/3 the dose of the adult vaccine. And it's been shown to be about equivalently effective for pediatric patients as for adults. It's about 90% effective. There's currently an ongoing study that hasn't been published, but has been studied in about 3,000 children in the US and Netherlands and a few other countries. And so far, the data about 2.5 to 3 months into the study suggests that it is a long lasting protection, at least for several months after the second dose of the vaccine, which is comparable to the adult studies. And so longer term studies are needed to really show how long the effectiveness will last for in children, especially in the 5 to 11 and the younger age groups. But right now we think it's going to be about as effective as the adult vaccine.
Great. So, ever since the vaccines were first introduced and we all got in line or tried to get in line to get our vaccine, there's been a lot of talk about how these vaccines work, and a lot of information and misinformation about it. Can one of you tell us just how does that work?
So we've talked a lot about Pfizer and Moderna. Both of those are mRNA vaccines, or their M stands for messenger RNA vaccines. And so that messenger RNA vaccine has a protein in it that looks like the spike protein of COVID. So it's not the actual virus itself, it's just a protein that gets injected into your muscle. Only those cells are affected. And it get recognized, they recognize that spike protein. So your immune system goes directly to those cells, starts to increase its number of immune cells that are effective against that spike protein. And it creates sort of an army of an immune system. And that way, if you are exposed to COVID, that army of immune cells are ready to go and can address that virus before it can make you seriously ill and before it can infect your cells itself. And so it is highly effective at doing that. When we talk about effectiveness of vaccines and that 90 to 95%, that means 1 in 10 or 1 in 20 may not have an effective immune response. That's why we have that second shot and the booster coming, but they are highly effective, all of them, no matter how effective we talk about it, at preventing serious illness, hospitalization, and death. And so that is the win of vaccines, is that it prevents us from getting very sick, going to the hospital, and dying.
And Raquel, you're out in the community a lot. What are you hearing about the vax from people? What is their hesitancy to be vaccinated?
So people believe that this vaccine is going to keep them from getting COVID. And so when they keep hearing reports that so many people are still getting COVID, even though they're fully vaccinated, that's one of the biggest hesitancies. We really want to stress that this vaccine is not going to keep you from getting COVID. It's going to keep you from, like Dr. Ellison was saying, having severe reaction, hospitalization, or even from dying. We can't guarantee that you will not get COVID, but knowing that you could prevent yourself or somebody else from being hospitalized and possibly dying from something you could have prevented, that's what we want you to understand, is that we're not saying you're not going to get COVID. You probably will if you are not wearing your mask and doing all of the guidelines that you're supposed to, but you won't end up in the hospital because if you are following getting the 2 vaccines or the booster. We're also hearing a lot, it's just the personal, you can't tell me what to do. They want to be able to make the choice on their own. And so they're doing it in that timely manner. We had a huge group of people that waited for the full approval from the FDA. And we did get a lot of people out once it was fully approved, once Pfizer was fully approved. Then they trusted it and were coming out. We've seen an increase in vaccines in the past few weeks. We have had more first doses this past month than we have in several months. So we were seeing a big hesitancy during the summer and early fall. But now, closer to the holidays, we're happy but surprised at how many people are now hearing us. They're understanding us, and knowing that the holidays were coming, and knowing that they were going to be indoors with several loved ones of an older age. A lot of them have come out and gotten it, especially now that their kids. We've had some parents too that were waiting to do it with their kids. So we've had a lot of parents come, and they wanted to wait to be that example for their kids. And so that was another holdup for a lot of the adults.
Speaking of kids, as we're going into the holidays, but we've also had kids go back into the classroom, and I've heard personally a lot of stories about, children don't always get what we would think of as a very full-blown case of COVID, but they also are infectious. What can you tell me about that?
Yes, and I can take this question. So we know that about 20% of cases in the United States are in pediatric patients, like in the school age to teenage years. And although children tend to get, less severe cases of COVID, that's not always the case. Children's Mercy has seen many cases of severe COVID and complications of COVID in form of multi-system inflammatory syndrome, which can have patients, in the ICU, and it has resulted in, thousands of children in the hospital, as well as, a couple hundred children actually dying of the disease. And so it's still a very dangerous threat to even children. And in addition to that, children can still be contagious to adults and can pass the virus to their loved ones, including their elderly family that they're visiting for the holidays. And by having, vaccine or herd immunity for children, it'll also protect the adults in the family as well, because children can, be, vectors and can spread the virus as well.
Right. So, when will we have? Is there any news on when that vaccine might be available to children 4 and younger?
Yes. So right now there are 2 trials going on with Pfizer. They're looking at a 2-year to a 5-year-old age group, as well as a 6-month to 2-year age group. Enrollment has been difficult because, again, the cases, the severity of cases kind of goes down the younger children are. We know that more severe cases are usually in teenage age group, and then there are some in the 5 to 11, but younger children, again, the complication, rate of COVID is a lot less. And so it's a matter of justifying, kind of the benefit of the vaccine versus the potential for any side effects from the vaccine in that age group, and enrolling children, that age for a trial. And so right now, Pfizer is the first manufacturer that's, kind of looking at that age group and is conducting trials. But I don't have a good estimation on the time frame of when those trials will be completed to when we'll know that information.
And when there's a kind of a timeline of when that might be available, then.
Yes. Yeah.
Right.
So it might be about a year. That's kind of what a lot of the estimates I'm reading is. But again, it kind of just depends on how the trial goes.
Sure. That's one of the things that everybody talks about is the side effects of the vaccine. Whether it's Johnson & Johnson, Moderna, or Pfizer. I think we've all, if you've been vaccinated or you've talked to somebody who's been vaccinated, that's kind of one of the questions that comes up. What can you tell me about those side effects, and how long do they typically last?
So I can take this. The side effects of the vaccine are definitely minor compared to the COVID vaccine or the COVID virus infection itself. So I'm in the emergency department at University Health Truman Medical Centers. And even in cases of patients where we can send them home, their symptoms are definitely worse with the infection than the side effects of the vaccine. So everyone's unique and different. With the first shot, there is a small subset of adults that had a side effect or a response. It's usually the same sort of feelings you get as you're getting a viral illness, not because we injected you with the virus, but your immune system is creating this inflammation in your body. And so commonly you'll get a headache, you'll get body aches, you might get joint aches, you'll feel some fatigue, you might want to take a nap. And those are the more common things. Some get a fever, and you can treat those with Tylenol or Motrin and hydrate and rest. And I just tell everyone to take it easy. Some of our adult patients get that on the second shot. Some get it both shots, and some don't get much of a reaction at all. It usually lasts anywhere from 24 to 48 hours, but all of those side effects are gone in about 48 hours and are easy to treat with things like Tylenol. And so I recommend to patients who are considering that first or second shot, just to make sure that they have a fairly easy day ahead of them before a weekend where they're off is really important. And then kind of planning ahead and just checking in with themselves and treating those symptoms. But no matter the side effects, I have not seen anyone have bad enough side effects to end up in our ER. And I have seen lots of patients with active infection who are very ill and end up in the ER because they're afraid or short of breath. And so the side effects of the vaccine are very minor in comparison to the infection itself.
Now, we have heard of some, early on, there was some talk of potentially some more serious side effects. Have those that had to do with the heart and lungs, has there, have those been, have there been more of those? Is that fairly uncommon? What can you tell us about that?
I'd actually even call it rare. So the side effect that I think is more recent is the inflammation to the heart in relation to the vaccine. And it's something like 3 in a million got it. They were young males that got it. Of those patients that they followed were those who were reported they had no serious side effects or damage to their heart. The inflammation itself is an infection inflammation around the heart, pericarditis around the heart, or of the muscle itself, myocarditis. And as a result of the vaccine, there were no untoward side effects, no heart failure or problems. We do know the COVID infection has caused pericarditis and myocarditis and very serious inflammation in the lungs. It also causes a lot of blood clots. So it's actually been known, the infection itself, to cause a heart attack itself. And so it's about a 100 times worse effect on your heart to get the COVID infection than any risk of the vaccine. So the benefits of the vaccine far outweigh the risk of the vaccine itself. And we know that COVID infection has serious side effects on your heart, including heart failure, heart attack, and death. And so even though that has been a side effect, it's been followed and hasn't shown any long-term organ damage or problems as we are seeing with the infection itself.
So once you've had your second shot, when does it take full effect?
Raquel, do you want to take that one?
Yeah, Dr. Kendall had answered it on the Q&A, but it's 2 weeks after your second shot. So it usually takes the 2 weeks after first shot for you to get full effectiveness of the first one, then 2 weeks after the second one. Same thing with booster. You just have to give it that 2 week window after each one of them. And that's I've been seeing a lot on the news lately. If you're trying to do this in time for Christmas, you really want to get on getting at least that first one 2 weeks before your Christmas gathering, because it is going to take that 2 weeks after actually receiving the vaccine.
So I'm a person who's fully vaccinated, and I've waited my 2 weeks and I'm ready to go. Why do I have to wear a mask?
Do you want to do that? Okay.
Yeah. So, although the vaccine is very effective, like the mRNA vaccines like Pfizer and Moderna are upwards 85 to 95% effective after the second dose, there is a chance that, that even with the vaccine, you might fall into that 5 to 10% where you don't develop a robust immune response. And so in order to protect yourself and protect others from the spread, we know that masks have greatly reduced the spread of COVID, and I would still recommend in crowded gatherings, to still wear a mask, even with the vaccine. I would say it's probably safest, for you and for those around you to wear a mask.
And I would also echo that it's a hard thing to ask someone's vaccination status,
Yeah.
but I think we should be very careful about who we're allowing into this close circle of people who are near us. And so if you're comfortable asking the immune status and how vaccinated, and if others that could get the booster have actually received the booster, I would ask those questions, especially if you're sharing a meal where you have to take your mask off. We do now know that those that are unvaccinated are 6 times more likely to spread the virus than those that are vaccinated. So we are less likely to spread it if we're vaccinated. And I guess I say we because I am vaccinated and boosted. But I have to know the status of everyone who's in close contact with me to really know the risk. And then we also know that the unvaccinated are 12 times more likely to have serious illness, hospitalization, or death. And so that vaccination status and whether or not you've received your booster are really important. And those are sometimes hard to ask, but I would encourage you to ask that of your family and friends before you create that situation where you're in close contact with them, such as eating.
Raquel, when you're out in the community, what are some of the things that you, when you're visiting with people, what do you tell them that kind of helps them maybe get over that hesitancy and that hump of whether or not they're going to be vaccinated?
I forgot to mention earlier, we're vaccinating about 20 to 30 first timers each clinic, which is again a big number compared to where we were at. And the people that we were vaccinating lately, they are truly afraid of needles. That is one of the biggest, that's what we're having to talk them down off the ledge. It's not even about the COVID vaccine. It's just a vaccine in general. They are so afraid of that needle. So we're always having to calm their fears. The size of the needle can be really scary if you are afraid of needles, because the needle does look pretty huge, but it really doesn't feel bad at all. So we always let them watch somebody else get it first and see their reaction. That always helps with adults even. Grown muscular men, you have to talk off the edge a lot of times. And always just giving them that personal story. We're always making sure that we make our lives transparent and let them know how it's affected each and every one of us at the clinic personally, so that they know why we got it and that we did get it. That's usually the first thing they ask us when they sit in our chairs. Did you get it? Are you fully vaccinated? They want to know which one you got. And so just being fully transparent with our story and what we have seen in the hospital and the numbers. We're always having to give them numbers within their certain zip codes. And so that's one good thing with our university health community team, is that we stay on top of those numbers per zip code. And so that way when we give them that personal information, it's by their community, so that we're not just talking about Kansas City as a whole. We're always trying to narrow down their specific neighborhoods so that they understand where they're at on that poll of how many people are vaccinated, how many deaths, how many, also people of color. We're always trying to get them to understand that they're falling behind on those numbers. And so we're trying to help them increase their chances of surviving this. So making sure that we're always prepared with that data to give them that background information is one way. We always develop education on a weekly basis on different COVID topics, and we make it in easy layman terms for them. We use a lot of picture explaining, because it's hard for everyone to understand all of the medical jargon that is even on the nightly news. So taking what CDC says and WHO, the World Health Organization, and bringing it down to our community levels, even the kids levels, and showing them, even with using a visual in our hands the day of, for them to understand what's happening in their body, what it can look like, and just bringing it down to everyone's level so that they can understand it at a better, and in language. University Health is huge on being able to provide education in all languages. Our team speaks 5 languages, so we try and translate all COVID education in language and provide it in language on site. So they're trusting of what you're telling them, and it's not just some piece of paper that you're handing them and expecting them to trust it. So always being ready to build that trust first with them.
You have clinics. Where are you going in the community, Raquel, when you have one of these shot events, those vaccination events?
So we have depended on our community partners that we had prior to the pandemic, who we know are trusted in each community. So we have already established which community leaders are trusted in each specific zip code area. And so we rely on that specific leader in that area code, and we will host it at their site. So for example, in the Hispanic community, we'll lean on the Guadalupe Center. With the church community, we will lean on one of the pastors that they depend on most for any kind of information, being health, mental health, anything. So we really make sure to investigate who is trusted, and then we lean on them to help us spread that education. So it could be a church, it could be a community center, it could be a school, it could be a mosque, wherever they feel comfortable. We try and provide that vaccine in that area of comfort, so that way they are more willing to come out and get the vaccine.
Is there a place on University Health's website that someone can go to and find where there's an event, a vaccination event?
Yeah, so we do have our website, and now that it's University Health, I don't know the University Health website by heart, sorry. But there's our 404 care line, which is 404-2273. And they also have in language nurses and interpreters ready for the different languages as well. And even on our website, it's available in both Spanish and English for sure. But they do list not only where University Health is going to be, but Jackson County Health Department is also one of our partners. And so we always list where Jackson County Health Department is going to be as well, so that we're covering a wide range of the city and not just around University Health. But weekends, evenings, we try and make it as available as possible, because we know people can't take off work, and especially with the school time, that's been one of our areas that we have to work on, is kids don't get out of school and off the bus and in the house until after 5 a lot of times. And so we are having to make sure to adapt the clinics to that, because our high schoolers are wanting to come out and get it, but by the time they get off the bus and walk home and get their parent home off of work, they can't get in until almost 6 o'clock. And then you have practices and so forth. And so we do try and put those on the website. And like I said, you can call 404 Care and just ask questions about anything, testing, vaccine, anything COVID. The nurses are there all the time, Monday through Friday and Saturdays, to answer questions.
Is
Did
our
put
supply? Oh, go
I
ahead.
did put the address in the comments. I don't know if everyone can
Oh,
see
very
it.
nice. Thank you.
universityhealthkc.org. And there are also University Health sponsored events during weekday evenings and on the weekends, where we're actually going into the community, to the places that clients and patients are already trusting. And even if they don't get the vaccine, we can spend 10, 20, 30 minutes as professionals talking about the vaccine to help them get to that point where they're ready and they trust it. And sometimes it's that day.
Very nice. Are supplies, vaccine supplies, pretty robust at this point? Are there any shortages of any particular one, or really can anybody walk into their local pharmacy, into one of your events, and be able to be vaccinated that day?
You can get Pfizer or Moderna. Moderna is only offered on Tuesday, Thursday during the week at University Health. But I have had trouble answering that question for Johnson & Johnson. But Walmarts across the city do provide Johnson & Johnson for those that want to stay with the shot they had before. And they're all needing that booster, because it's recommended 2 months from your last shot. So if someone's really wanting to be loyal to that vaccine, I've heard Walmart provides it as recently as last weekend. So
I would just say call ahead. We get a lot of people who come out only wanting a certain kind. And to save them a trip, especially for our transient community, we call ahead if possible and make sure, because different locations carry different vials. So definitely call ahead.
If someone has already had the COVID-19 virus, why do they need to get vaccinated?
and take that, Dr. Kendall.
I can take this one. Yeah.
Mhm.
So we know that the immunity from natural infection wanes over the course of weeks to months. There have been studies that looked at immunity, like natural immunity from prior infection, and we know that that the vaccines provide a higher level of protection, a higher level of antibodies compared to natural immunity. There are patients that do have some level of natural immunity, and so I know there's been kind of some debate on, how soon after a COVID-19 infection is the best time to have the vaccine, and the answer varies between 1-3 months. It's difficult to really say, but I would recommend that anyone who's several weeks to months after infection, talk to their local primary care doctor about when the best time would be for their first vaccine, because again, natural immunity from a prior infection doesn't necessarily guarantee long-lasting protection from the virus.
Well, I think the elephant in the room is, in the last few days, we've heard about the new variant. I'm gonna try to say it. Omicron variant, which is by all accounts not reached the United States, but has come as close as Canada. What can you tell us about that, and kind of what do people need to be aware of, listen for, be prepared for?
Omicron is a new variant. It started in South Africa, and you are correct. We now have cases in Canada, which means it's a matter of days to weeks before it's in the United States. I like to address this as we did when Delta became the new variant, is that it's a demonstration that this virus has mutated because infections continue. And so we just have to be very vigilant and wearing our masks, which we know prevents transmission. We have to be washing our hands and following all those rules we've been talking about for almost 2 years until we actually know if our vaccines will protect us. The vaccine manufacturers and those who develop the vaccines are hoping that it will protect us. We were lucky with Delta. Our vaccines did protect us from that variant. But as these viruses do what they do, they want to survive. But in this case, they sometimes kill their host. And so sadly, if we don't stop spreading the virus, that's the reason that we're seeing these new variants. And so it's just another example that we must mask to prevent spreading it, and vaccination is the way through. It does decrease transmission, and it also protects individuals from getting very sick. And so I would just encourage everyone to consider getting vaccinated. I also want to dispel a myth. And I know that I have heard this misinformation that the vaccine has created the variants. And I want to make sure and explain that the participants know that it is the unvaccinated person that gets infected that spreads the virus, that allows that virus to continue to, spread and then mutate. And so it is really, the mutation is a feature of the unvaccinated. So our real way to stop these variants from coming about and developing is to get as many people vaccinated as possible. And it's exciting that we can now vaccinate those that are 5 to 11, because that will get us much closer to active herd immunity, meaning we provided the vaccine to protect everybody. And then that will soon and hopefully burn this virus out until it's just a virus that can survive, but it's not killing so many of us as hosts. And so the vaccine, masking, washing hands, safe distancing will continue until we have enough of our population vaccinated worldwide.
One of the things you said was 2 years. We've been at this for 2 years, and there is a lot of fatigue. Mm-hmm. People are, we're coming up on our second Christmas. We just had Thanksgiving. People got together, probably many families for the first time. It was still kind of tense, to say the least. For some people, they weren't really sure if they really wanted to get together, but there was that pull of family. What would you say to the people? And I'm sure that out in the community, Raquel, you see folks all the time who are, maybe a little tired of wearing the mask, maybe a little tired of social distancing, washing their hands, the fear of rubbing your eyes or, scratching your nose. What do you say to those folks?
Well, it's still here. It hasn't gone anywhere. In the United States, we're still battling the first, we're still dealing with Delta. We can't really, like Dr. Ellison was saying, we can't really focus on the new variant when we still haven't gotten our 100% vaccinated here in the United States. So right now, the biggest thing we stress is we just need you vaccinated to deal with the beginning of this. We can't even start to focus on new variants because we're still battling Delta right now. We definitely want to stress that, yes, like Dr. Ellison was saying, it's going to come, and we have to be patient with seeing if our vaccines will fight that. But right now, I just definitely want to mirror what Dr. Ellison was saying, is that it is vaccinate, 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 and a testament to mask wearing and PPE equipment and washing hands. We're a team of 10, and we were the first hospital out in the community doing testing and then vaccinating. And in the 2 years, the 10 of us, not one of us have gotten COVID. Because we do practice those safety guidelines on a daily and weekly basis. And we have to in our personal lives in order to be at work to care for others. And within that 2 years, not one of the 10 of us have gotten COVID. And we've all been tested several times, but not once. And so it's a true testament to how much mask work, social distancing, staying away from the crowds, and just following those guidelines, that it's saved us. Mm-hmm. Thank God.
Well, let's talk about the numbers. We're certainly have a lot of people in the community. They're not wearing masks. They're tired, and they really don't know anybody who has COVID. What are you all seeing in the clinics and at the hospital when it comes to number of COVID patients, and kind of, what's the trend in the Kansas City area?
So I practice both clinical and inpatient medicine as well, and so I get to see kind of some of the hesitancy to the vaccines in the clinic, and also kind of the consequences of people not getting the vaccine when they are admitted to the hospital, and like the intensive care and hospital ward setting. And what I'm personally seeing is all of the patients I have admitted to the hospital right now are not vaccinated. They were kind of hesitant to get the vaccine for a number of reasons, and as a result, usually they have family members at home that are sick and battling the virus that they have to be separated from, while they have to battle kind of a lonely fight against COVID on their own in the hospital, in kind of dark rooms on oxygen, with nurses and doctors going in with all of this protective equipment on to take care of them. But it's a tough fight for them, and I think a lot of them, when they're in the hospital, have kind of a regret that they wish they had got the vaccine. I haven't met many patients who are resistant to the vaccine. They're asking for the vaccine when they're in the hospital, and I wish I could go back in time and refer them to Raquel or one of the clinics to get the vaccine. But yeah, it's still a struggle, and most of the patients that are admitted are the ones that haven't had any of the vaccines.
Yeah. I worked Sunday, and the first 3 patients I saw had COVID. And it's been a while since I've worked a shift like that, where it wasn't overwhelmingly with COVID. And so patients are returning with it. And each and every one of them said, "Can I get the vaccine now?" We don't give it to you while you have the acute infection, but as soon as you're well and you're not sick anymore, we will give it to you as you're being discharged from the hospital. In the ED, if you are lucky enough to test negative, we'll give you the vaccine right then and there. If you're not sick from something else, we're seeing a couple cases of the flu. We are heading into the season of all kinds of viruses, all of which are contracted by similar means, respiratory droplets in close contact and touching your face and nose and mouth. And so we're seeing an increase in COVID in a way when we started vaccines, I didn't think we'd see. I think at one point we heard scientists and health professionals predict that we were hoping to keep our deaths at 500,000 or 500,000. And the numbers have still gone up and are still going up even since we've prepared for this to talk about it a month ago. And so in the United States, we now have 771,000 deaths. And I'm saddened by that, because I really celebrated when the vaccine got here, and I thought we could keep our number of deaths down. Sadly, we're at 48.1 million cases in the United States. And worldwide, it's up to 262 million cases and 5.21 million deaths. And that is too many. Too many when we have vaccines available to us. But the good news is in the United States, I think I heard the last day or two, the United States is giving 1 million doses to South Africa. I've heard that China's also donating 1 billion doses. And so the way through is the vaccine. And I really, really want to see that curve flatten and drop because we've seen a biphasic rise already, and that's occurring with a vaccine. So we really need to work on helping our patients feel more comfortable with the vaccine and get vaccinated. And bring a friend. I vaccinated my parents as soon as I could, and then I vaccinated my children. And if I trust it that much to vaccinate those dear members of my family, I want you to trust it enough to get a vaccine for yourself and for a loved one.
You know, we live in a world of maybe information overload. Some of it's misinformation, some of it's good information. I think I've run into so many people who say, I know somebody who was vaccinated and they got COVID and died. How common is that? And typically, if somebody does, you know, what was their most likely their story?
I like to think of Colin Powell. He's iconic. He's wonderful. I cried when I heard that he died, and it was in the media that it was due to COVID and that he was also vaccinated. But he has his own unique story. I believe he recovered from multiple myeloma, which means he has his own health condition. He's also over 65. And I don't think at that time there was the option to get the booster. And so I'm not sure that the vaccine was doing what we know it can do. And we should be giving those boosters so that we have a strong immune system to it. But every patient is unique. And we have to make sure that we understand the risk for our older patients with chronic medical conditions who are immune compromised, who might be getting chemotherapy, who are cancer survivors or with ongoing treatment for cancer. And so we need to understand those risks and that the benefit of the vaccine far outweighs the risk of not getting vaccinated.
And again, wearing masks, making sure that the people around those people who are immune compromised are vaccinated and boosted if possible.
Yes,
Would that
absolutely.
also be the case? Should people with allergies be, worried about getting the vaccination, or and what can you say to those folks? I'm sure you've had people come through, Raquel, who say, well, I have allergies and I probably shouldn't get it, but you can give it to my friend or my children or my spouse.
Seasonal allergies or an allergy to the vaccine? Sorry.
Either one. I think
Okay.
the idea is that it's just like, I'm allergic to a lot of things. I'll bet you anything I'm allergic to this as well.
Well, as a seasonal allergy sufferer, it's so embarrassing to sneeze and to be sniffling. This was a really bad year for allergy sufferers. So it's almost, when you get the hard stares in public when you are having an attack of with pollen or anything outside. I would definitely first, don't always assume it's seasonal allergies, because those very minimal symptoms could be all the symptoms you have during a COVID infection. So that's one big thing that we've had a lot of people say they're having, when they usually have a seasonal allergy in the fall, but yet it's deep of winter and they're still having seasonal allergies. That could possibly not be an allergy issue. So always be on the caution of, maybe this could be something else. It is, so with the kids that are getting, and Dr. can attest to this, they haven't had all exposure to everything as much as adults have. And so there is a greater chance for them to have a reaction with the vaccine. And that's why we have doctors on site for most of the vaccine clinics with the younger kids, because we are being overly cautious to make sure that they might be a first timer. Some of them are 5 years old, so we don't know what all they're allergic to yet. And so we want to make sure that we always are more cautious than, we have the Anaphylaxis Kits on site. Every single clinic has one on site in case there is a reaction, an allergic reaction. And there's always trained personnel to be able to respond to an allergic reaction, but they are rare. In the community, our community team alone has done about 7,500 vaccines, and we haven't had not one allergic reaction in the community at all. So they are very rare. I wouldn't let the fear of a allergy to the vaccine keep you from getting a vaccine. And I would also say ACLS certified. So we're advanced. We're trained to revive you if anything happens. We have all the medications, injections to help if you do have one. But most of the reactions we have seen in the community or at the hospital with the vaccine is because of the fear. They are so overwhelmed or so anxious with receiving the vaccine, or so happy in the beginning. We had some people who were just so enthused that they're finally getting this vaccine that they would get, a little clammy and, would think it was a reaction to the vaccine. So I would not let that keep you from learning about it, asking your doctor about your past medical history, if they think you would be allergic to it. And if you do have allergies, doctors will give it to you in the office. If you do have a history of allergic reactions, you have the option to do that in-house with your physician or any physician. So that should eliminate the fear.
Yeah. So if you have allergic reactions to immunizations, you can work with your allergist to be observed getting that vaccine. And we've also done a few early on with the vaccine in the emergency department for the staff that were required to get it. And they did fine. And Raquel's right. The majority of people just pass out. It's not a true allergic reaction. It's just your heart rate, blood pressure drop, and we put your feet up. And then when you get your second shot, we just start that way. We just put your feet up.
Yeah.
Even with the Arrowhead event, we did, I think, over 7,200 vaccines. We had one response that there were 3 of us emergency physicians running around. We got to do field medicine, which I don't get to do very much, and they did fine. I'll be honest with you, treating anaphylaxis, which is rare, Raquel's right, it is rare, is easier to treat than very severe COVID. That I still struggle with. That is really hard, and it's long, and it's 3.5 to 4 weeks in an ICU with very, very severe illness. And so I'll take anaphylaxis every day because we can treat you for that. But the real way through is the vaccine and working with your allergist. If you're allergic to that polysaccharide or any of the components, it's a simple vaccine. Actually, you can go in your allergist's office and get pre-treated and observed for 30 minutes. And our patients that we did that in the ED over the weekend and on evenings, it went just fine.
Yeah. And don't believe stories that you've heard. We've had the telephone game where it was we've had patients who forgot to eat that morning, who were diabetic, and so who would have a diabetic episode, and then the story would travel that they passed out from the vaccine. And don't always believe all the stories you hear.
One of the things that people, are concerned about these days is privacy. So when someone comes into a clinic, into one of the vaccination events, what's the information that you get from them, and what happens to that information once they've been vaccinated?
So all information that is collected from you. So the vaccine is free, like Dr. Ellison was saying. We do collect insurance information because your insurance is billed for it. You will never receive a bill. And those people who don't have insurance, they still collect your information so that we can report that you have been vaccinated to the state, because we are keeping track of those numbers. But even if we are out in the community at a church or a gym, wherever we're at, that information is protected through HIPAA, as well as the same as it would be inside the hospital. So that we are responsible for those. If it's paper form, we take those with us, and we out in the community for University Health, we have our security team with us. All of it is protected from the moment that we leave there. Even with us, it's in our cars. We take it straight back to the hospital. And if it's not sent to medical records and it's shredded right away, it is all completely protected. And everything, we're not reporting it to your doctor's office or anything like that. It's more of just the numbers of how many people and what zip code, and we're trying to report that so that way we can increase the numbers in those certain areas.
At this point, what is the vaccination rate in the Kansas City area and the state of Missouri?
I think we're still right at 48%. We're slightly better than Kansas. That might be my competitive nature, but they're
Yeah.
rural state. And they're working so hard. I just can appreciate that. I mean, we're a state with two big cities, right? St. Louis and Kansas City. But I've still seen it hovering 46 to 47%. And they even further break that down to 2 shots. And so a lot of us are getting to where our booster is necessary and we're waiting for our turn. At least one of my daughters who's 17 is due her booster, but it's not her turn yet. And so you have to keep that in mind as we're driving everyone indoors. The weather's getting cold. We're together for these 2 major holidays around food. I am genuinely worried, and I wish we could just booster everybody. And I suspect those under 18, they're waiting to give those shots to 5 to 11 so they can at least get their original vaccine through. And then they'll offer those boosters to those kids that are due to get theirs. So I still think it's right around that 47, 48%, and it'll further be broken down into 1 or 2 shots. Most of them are 2. And then those that are fully vaccinated who are due their booster. So I will be skipping and buying everyone drinks when we get to 70%, which isn't totally, and Raquel's heard me say this before, and you're invited, everybody. Maybe not everyone in Facebook land, but when we get to 90%, that's when we're going to really see us rivaling and beating this virus. And that's where we need to get. So we'll keep working on that.
And if I know there are multiple places that are providing incentives now for you to be vaccinated. So if you need that incentive to convince your neighbor, family, nephew, niece, there are places. I mean, there's something as small as a $15 gift card to Hy-Vee, or there are definitely, to $100 to $200 cash for vaccines. So it's just a matter of, if you need that push to convince somebody in your family or in your group, you can find it. You can find an incentive nowadays in order to help.
Absolutely.
One last question, and then we'll get to the Q&A. Let's say I'm a person who I really like to do my own research. I want to read about it myself. I just don't want to take somebody's word for it, even if it is a medical professional. What are some of the resources out there where I can, that I could go to get some of my questions answered and just do some little deeper research? And also about if I have children and I want to know a little bit more about the pediatric vaccination.
So my resource is the CDC website, so cdc.gov. It provides lots of information at all different reading levels, and it provides information on the vaccine, on COVID, on the variants, and it's an updated site. So so it's constantly being reviewed and being provided with accurate information. So
let's get to the, oh, go ahead.
I was going to say, bring up a good question about trust. And so go to your own health professional that you're seeing, whether it's a nurse practitioner, a physician, a PA. You already have worked with them, you've trusted them with your healthcare. So ask them their opinion, because you have that relationship. And we've talked a lot about that tonight, is going into those communities where you already have trust. And so start with a health professional that you trust. And I agree with the CDC website. It's very readable. Our university health website has lots of myths and answers, and they update that regularly. And you can, if you have to talk to someone, which I know a lot of people do, 404 Care will answer your question in multiple languages. So those are local things where you can feel like, I know what's happening right here, right now, and that it affects me directly. And so those are really good sites for that.
And I would say, because we are in high schools a lot, in teaching your children to not always believe everything on social media and to always look for that source on the bottom of anything that is posted. Does it say CDC? Does it say World Health Organization? To always look for that citing on that post. So we definitely need to get our younger generation to start looking for that site and making sure that it was cited by somebody credible.
Yeah.
Let's get to the question and answer. We have a question. Will COVID ever end? Will we ever see a world without COVID? And or will it become just a seasonal thing that people, it pops up and we go, oh, so and so had COVID. Will it be as serious? Will it become a seasonal flu? What can you say about that?
It's already proven it's not seasonal. It's a year-long thing. And really the increases have all been related to the ability to protect ourselves with masks and using masks appropriately. The only way through is the vaccine. When we really get to a 90% vaccination rate, and that we allow that passive immunity that we acquire from an effective vaccine to work, I do fear a lot of us are going to get COVID. It's just so prevalent. It's so contagious. And it will take that high vaccination rate and those of us getting exposed and it really not being strong enough to hurt us because we're all vaccinated and we have that immunity to protect us, that there will come a time where it's similar to flu season, that mild flu season. We're going to hopefully have a mild COVID season where we are vaccinated enough with strong immune systems and we are not getting as sick or hospitalized or dying from it because our vaccination rate has gone high enough to protect us. That's when it will feel like it's historical and we've conquered this and we can have our freedom back.
So when a vaccinated person gets the virus, does that stop it from mutating? Or, as a vaccinated person, if I were to get COVID, is there a chance that it could mutate in me and I could be the next, I could be patient zero with the next variant? How does that work?
I don't think we really know. We do know there are breakthrough cases where vaccinated people have caught the virus, but it's mild. We do know they transmit it less frequently. So they're less, they're 6 times more likely if you're unvaccinated to spread it, so that you're less likely to spread it as a vaccinated person. And so when you reduce that transmission rate between humans who are vectors, then you reduce the risk of it mutating. But as a virus, it does what it wants to do. I mean, it may say like, wow, there's this really strong immune system, and they mutate quicker than we actually predicted this virus would. It's hard to know, but we know vaccinated patients are transmitting it less. And they're having very mild illness from it. So it would be less likely that vaccinated people are going to encourage that mutation, like those that are unvaccinated who are transmitting it more often and are getting severely ill from it. And it's in their system and their immune system's not able to fight it because they haven't been vaccinated. And so it is far more likely for an unvaccinated person for a virus to cause a serious infection and create that mutation and transmission to others.
Well, thank you so much for all your time tonight and all your great information. If you are interested in more information, we've put some links in the chat. And there's also, be sure and watch for the survey that you'll be sent and let us know how you felt about like tonight's program. And also always tell us what other programs you would like to see Mid-Continent Public Library bring to you. And as Angie said at the very start, we read every comment. So you will be heard, and we always try to bring our patrons the programming that they would like to see. So on behalf of Mid-Continent Public Library, I'd like to thank each of you for taking time out of your busy schedules to talk to us about such an important issue and something that really is so timely. There's just, the Christmas season coming up and the new year. We hope that we can we've given people the answers that they need to their vaccination questions. So thank you so much.